Good afternoon, ladies and gentlemen. Thank you for joining today's webinar on the Affordable Care Act and what the healthcare law means for small businesses. For full disclosure, this webinar is being recorded. My name is Mary Timmel, and I am the Midwest Outreach Manager here at Small Business Majority. We're pleased to be presenting this ongoing series with our partners at the Centers for Medicare and Medicaid Services and the Small Business Administration. I'm happy to be joined by representatives from each of these organizations, Meredith Olafson from the SBA and Laura Eldon from CMS, who will be delivering the presentation today. Before we get started, however, I do have a couple of quick housekeeping announcements. First, I'd like to note that this call is off the record and not for press purposes. If you are a member of the press and you'd like to speak to someone about the Affordable Care Act, please respond to any of the emails you have received about today's presentation, and you will be connected with an expert. Second, we will be sharing the slides that form the basis of today's presentation via email following the presentation. So keep an eye out on your inbox for that email. This webinar is also being recorded. That will not be included in the original email you get, but we will have that available to you for follow-up. Also included in that email will be the registration link for the next webinars on this topic. This is part of the ongoing series, and we will present this information along with the SBA and CMS moving into 2016. If you'd like to hear the program again or know someone who would benefit, please feel free to keep an eye out for future registration links. And finally, we will be taking questions throughout the presentation today, and we'll answer as many as possible at the end of the webinar. Please enter your questions in the chat box on the lower left-hand corner of your screen. And with that, I'd like to turn it over to Meredith with the SBA. Meredith.
Great. Thank you so much, Mary, and thanks to Small Business Majority for hosting us and being such a great partner with the SBA and with CMS in helping educate small employers about the Affordable Care Act. At the top, before we get started, I did want to flag for folks that we are in the middle of open enrollment for the marketplace under the Affordable Care Act. And so if you are self-employed with no employees, or for friends and family members, if you want health coverage and are exploring options at HealthCare.gov and you want coverage to start by January 1st, the deadline to sign up at HealthCare.gov is December 15th. So right around the corner. Don't wait until the deadline. Visit HealthCare.gov today to see what the options might be. In terms of financial assistance, about 8 in 10 of uninsured who are eligible to buy coverage at the marketplace do qualify for financial assistance. And many folks can find low premium plans for $75 or less. So encourage folks, if you're looking, again, if you're self-employed or friends and family members looking for coverage, urge you to go to healthcare.gov today, and definitely if you want coverage by January 1. The deadline is Tuesday. So wanted to flag that before we got started. We'll talk about it again when we talk about the marketplaces. And just to reiterate for folks that the information we're providing today is for informational purposes only, not as tax or legal advice. You should definitely consult your trusted advisors to figure out how this information relates to your own unique business circumstances. Just an overview for today's presentation, a roadmap. We're going to cover 3 main topics. First, the Small Business Healthcare Tax Credit. Second, we'll talk about the marketplaces, both for individuals and self-employed folks, as well as small business owners. For small business owners, the marketplace is known as SHOP, or the Small Business Health Options Program. So 2 sides of basically the same marketplace. And then third, we'll talk about the employer shared responsibility provisions, also sometimes known as the employer mandate, along with the companion reporting requirements that kicked in this year. And then, as Mary said, we'll take your questions in about the last 10 minutes or so via the chat feature. So keep them coming throughout the presentation, and we'll get to as many as we can at about 10 till 3. So before we dive into the tax credit, just wanted to talk a little bit about what ACA has meant for small businesses in terms of the small group market. So, you know, before the law was passed in 2010, there were a lot of obstacles if small employers wanted to provide coverage, fewer choices in the small group market, higher premiums and often unpredictable rate hikes, certainly higher rates for groups with women and older workers and those with chronic health concerns, and then often no coverage at all or longer waiting periods for folks with pre-existing conditions. Under the Affordable Care Act, insurance companies now face limits on administrative spending, and what that has meant for individuals and small businesses is that insurers must now spend at least 80% of premium dollars on actual medical care, and if they don't, they have to rebate the difference to small employers. Also, and consumers. Also, insurance companies can no longer charge higher rates or deny coverage based on pre-existing conditions. You can no longer charge higher rates for women, so no gender is no longer a pre-existing condition, and there are limits on charging additional premiums for older employees. And then jumping to the bottom, plans that are offered in the small group market on or after January of 2014 have to include a core set of essential health benefits, so things like ambulatory care, maternity and newborn care, prescription drug benefits, just a core set of about 10 or so benefits that must be provided. And then feel free to come back to this slide and some of these earlier slides at your convenience. I do want to dive into the main meat of today's presentation. And we will flag for you, because we just continue to get this question, which provisions apply depending on kind of the size of employer. So if you also want online resources segmented by employer size, you can find that at SBA's website, HealthCare.gov/healthcare. We break it down by self-employed. What do you need to know if you're self-employed without employees? If you have fewer than 25 employees, up to 50 or 50 or more. And so some of the provisions of ACA segment along certain size of employers. So we've tried to organize today's presentation in that fashion as well. So first, the small business healthcare tax credit. First, we're going to talk about which businesses are eligible and then a little bit about how the credit works. The good news is that none of this is something you have to memorize. There is a great tool calculator at HealthCare.gov, which I'll highlight in just a moment, in which you can input these eligibility criteria and figure out if you're eligible for the tax credit and how much it might be worth to you. So we do want to give you a sense of who's eligible so you can take this information to your tax professionals. So there are three basic criteria in order to qualify for the tax credit. The first is a size standard, so the employer has to have 24 or fewer full-time equivalent employees. Second, you must have average annual wages below $50,000. And then third, as the employer, you must contribute at least 50% towards your employees' self-only premium costs. So those are the three basic criteria. For the size standard and the average wages, it's important to know that if you're the owner of the business or any spouse or family members of the owners, those folks don't count towards your size standard or your average annual wages. You're excluding from that calculation the owners, including sole proprietors, partners, shareholders owning more than 2% of an S corporation or more than 5% of a C corporation. I mentioned spouses and family members, and it's a really expansive definition. So mother-in-law, step-parent, nieces and nephews, those folks are not counting as employees for the purposes of your size standard or your average annual wage. And the credit works on a sliding scale. What that means is that the maximum tax credit is available to those employers on the smaller side of this scale. So those with 10 or fewer full-time equivalent employees and average annual wages of less than $25,000. Next, it's important to know the tax credit is available to both for-profit entities and tax-exempt employers. It just works a little bit differently if you're tax-exempt. So we'll jump to bullet number 2 because we are in the next phase or the next iteration of the tax credit. Starting last tax year, the credit rose. It was originally a credit of up to 35% of for-profit employers' premium contributions, 25% if you're tax-exempt. In 2014, those levels went up. So now the credit is a credit of up to 50% of for-profit employers' premium contributions and up to 35% for tax-exempt employers. If you're tax-exempt, the credit comes in the form of a refund. So that's how it looks a little different for tax-exempt charity nonprofit orgs. To take advantage of the credit, employees must enroll in coverage that's offered by you as the employer through the SHOP marketplace. So we're going to talk about SHOP in just a moment, but that's the additional requirement for the tax credit as of starting with last tax year and years beyond. And then this credit of up to 50% or 35% if you're tax exempt can be claimed for any 2 consecutive taxable years. So it maxes out after the 2-year mark, but you can take it for any 2 consecutive years that you choose through the SHOP Marketplace. And so I did mention the tax credit estimator, hopefully making it easier on folks to figure out how the credit works, whether or how much it might be worth to you, and that's at the HealthCare.gov link that we have up on the slide. The next slide just summarizes the eligibility criteria that we've already talked about. And again, as I mentioned, the credit is refundable, so even if you have no taxable income, you may be eligible to receive the credit as a refund as long as it doesn't exceed your income tax withholding and Medicare tax liability. So encourage folks to go to HealthCare.gov to learn more. And with that, I'm going to turn it to Laura Eldon, who's with the Centers for Medicare and Medicaid Services, to talk about the marketplace.
Great. Thanks, Meredith. And thanks again to the Small Business Majority and for everyone else for joining us today. As Meredith mentioned, this portion of the presentation is going to provide an overview of the SHOP Marketplace. We're going to focus on the SHOP Marketplace that is run by the federal government, and that is based on HealthCare.gov. Some states might be running their own SHOP Marketplace, and those states might be operating their SHOP Marketplace a little bit differently. So if you're unsure whether your state uses the SHOP Marketplace that's based on HealthCare.gov, or if your state runs its own, we do encourage you to go to HealthCare.gov. Once you get there and you select the Small Businesses tab, you'll be able to select your state, and if your state is a state-based shop, you'll be redirected to your state's website. So with that, we'll dive right in. So what is the SHOP Marketplace? The Small Business Health Options Program, or the SHOP Marketplace, is the health insurance marketplace that's for small employers. It helps small businesses research, compare, and select health insurance for their employees, and it also makes it easier for small businesses to offer affordable and quality coverage. As I mentioned, some states are running their own states, while others are participating in the SHOP Marketplace that is available through HealthCare.gov, and we're going to be focused on the SHOP Marketplace that is available on HealthCare.gov. So generally speaking, the SHOP Marketplace is open to employers with 1 to 50 employees, and that's including nonprofit and religious organizations. Though the SHOP Marketplace is also available to employers with 1 to 100 employees in some states. The SHOP Marketplace offers a choice of health and dental plans and also tools to help the customers make informed purchasing decisions. And employers and their employees can submit an initial group enrollment for SHOP Marketplace coverage at any month throughout the year. Once the initial group enrollment is submitted and the coverage actually goes into effect, the SHOP Marketplace enrollments are limited to an annual enrollment period for employees, special enrollment periods, and also enrollment periods for newly eligible employees. And as Meredith discussed a little bit earlier, if employers offer their employees coverage through the SHOP Marketplace and they meet other eligibility requirements, small employers may be able to claim the Small Business Healthcare Tax Credit, which can be worth up to 50% of their premium contributions. Small employers, their employees, and those assisting them can compare and enroll in SHOP Marketplace coverage all through HealthCare.gov. And through the SHOP Marketplace, small employers now have the option to offer their employees a choice of health and dental plans, much like large employers do. And small employers with fewer than 50 full-time equivalent employees are not required to offer their employees health insurance, and there's no penalty if they choose not to. So there are several benefits to offering coverage, health and dental insurance through the SHOP Marketplace. The SHOP Marketplace gives employers both convenience and choice. As I mentioned earlier, small employers, their agents and brokers or others who may be assisting them can complete a group enrollment at any point during the year. They can browse, compare, apply, and enroll in SHOP Marketplace health and dental plans, all on HealthCare.gov. Employers have the option to offer their employees a choice of health plans, or they can offer a single health or dental plan. And despite the fact if the employer offers several health or dental plans, the employer will receive just one monthly bill, and they'll just pay one monthly bill. The shop will take care of dispersing the payments. I will note on enrollment that in the SHOP marketplace, if an employer's initial group enrollment is completed between the 1st and the 15th day of the month, the coverage could begin as soon as the first day of the next month. So, for example, if an initial group enrollment is completed on, say, October 10th, group coverage could begin as soon as November 1st. But for those initial group enrollments that are completed after the 15th of the month, coverage could begin as soon as the first day of the second following month. So, for example, for an enrollment that's completed on October 18th, coverage would begin on December 1st. So the SHOP marketplace also gives employers control over spending. Employers get to decide which plans to offer to their employees and how much they'd like to contribute to their employees' premiums. Employers will also decide whether or not they want to offer coverage to their employees' dependents and also how much to contribute to those dependent costs. We talked about the small business healthcare tax credit, and that is another great added benefit to offering coverage through the SHOP marketplace. And finally, the SHOP marketplace offers many ways to get help. Employers can search for an agent or broker or other assister that's in their area through the Find Local Help tool on HealthCare.gov, and they can do that without creating an account. The SHOP call center is also available to assist agents, brokers, employers, and their employees, and we'll talk a little bit more about the SHOP call center later in the presentation. So now we're going to discuss which employers can actually participate in the SHOP marketplace. So as I mentioned earlier, in most states, the SHOP marketplace is open to small employers with 1 to 50 full-time equivalent employees. And some states, as I mentioned, may allow their employers with up to 1 to 100 employees enroll. So we encourage you to contact your state Department of Insurance to find out if your state is open, if your state's SHOP marketplace is open to employers with 1 to 100 employees. So just a little bit more on counting employees. So part-time workers whose combined hours total at least 30 hours per week are also included when determining SHOP marketplace eligibility. Employers must have at least one employee on payroll enrolling in coverage who is not a business partner or spouse to be eligible for SHOP marketplace coverage. HealthCare.gov does offer an online tool, the SHOP FTE calculator, that can help employers and those assisting them count how many full-time equivalent employees they have to help them determine if they might be eligible for SHOP marketplace. And to participate in the SHOP marketplace, employers must offer coverage to all full-time employees who work an average of 30 hours or more per week. Employers must also have a principal business address or eligible employee worksite in the state in which they're offering SHOP marketplace coverage. If you're an employer who has employees in more than one state, you have two different options when you're offering SHOP marketplace coverage. Employers can either choose a single health plan with a multi-state or national provider network and offer it to all employees in all of the business locations, or they can create a SHOP marketplace account in each state where the employees have a primary work site. And as long as the business in each of those states meets all of the criteria to participate in the SHOP marketplace, they can go that route. So as Meredith mentioned earlier, we also do have some different options for those for the self-employed. So self-employed individuals, sole proprietors, and shareholders of more than 2% of an S corporation that has no common law employees can't buy health insurance through the SHOP marketplace. But these individuals and their spouses may qualify to buy insurance through the health insurance marketplace for individuals and families. And depending on the level of household income, as individuals, the self-employed, and the sole proprietors may qualify for tax credits that are available through the health insurance marketplace. And while eligible small employers can complete an initial group enrollment at any time during the year through the SHOP marketplace, individuals using the health insurance marketplace generally must enroll during the open enrollment period. So as many of you may know, open enrollment for 2016 coverage began on Sunday, November 1st, and it will end on January 31st, 2016. And just looking at today's date of December 10th, to meet the deadline for January 1st coverage for the health insurance marketplace for individuals and families, there's 5 more days. The deadline for January 1st coverage is December 15th. Outside of open enrollment, however, sole proprietors, self-employed individuals, and their families may be eligible for a special enrollment period in the health insurance marketplace if there's a change in the life situation, known as a qualifying life event, and also in other certain limited circumstances. And some examples of qualifying life events include moving to a new state, certain changes in income, changes in family status or size, like getting married, getting divorced, or having a baby. So the next SHOP area we're going to talk about is the SHOP Marketplace minimum participation rate. So before employees can actually complete an enrollment in the SHOP Marketplace plan, the employer will need to meet the minimum participation requirement for their state. In many states that are using the SHOP Marketplace on HealthCare.gov, at least 70% of the business or group's employees who are offered coverage must accept that offer of coverage before any of the employees can enroll. States and issuers may also set different participation requirements for small group plans that are offered outside of the SHOP Marketplace. In a few states, as I've said, the SHOP Marketplace will have a different minimum participation requirement, so please visit HealthCare.gov for more information. There is an exception to these minimum participation requirements, which I would like to highlight, and that's from November 15th through December 15th of each year. Employers can buy small group coverage through the SHOP Marketplace without having to meet any participation requirements. So once again, if you're an employer and you are having difficulty meeting the minimum participation rate that is required by your state, we do encourage you to enroll during this 1-month period, which is currently going on now. So if this you think will affect your business, we encourage you to get your enrollment going before the 15th of the month. So on this next slide, we're going to talk a little bit about how to actually calculate the minimum participation rate for your business. So an employer's participation rate is determined by taking the number of employees who are enrolling in coverage that's offered through the SHOP Marketplace and dividing it by the total number of employees who are offered coverage. For plan years beginning in 2016, the calculation is a little bit different than it has been in years past. So, and we're just going to cover what it is going forward as opposed to what it has been in the past. So for plan years 2016 and beyond, all employees who are enrolled in qualified health coverage will be counted towards an employer's minimum participation rate, making it easier for employers to enroll their small business and SHOP Marketplace coverage. So that means that any employee who's either accepting their employer's offer of SHOP Marketplace coverage, or if they're enrolled in non-SHOP Marketplace coverage, but they are enrolled in qualified coverage, will be counted towards the employer's minimum participation rate. And so this should make it a lot easier for some small businesses to meet the rate that's required by their state. And employers don't need to calculate the minimum participation rate themselves because the SHOP Marketplace enrollment application will actually do this for them and determine whether or not they've met the minimum participation rate. And that determination is based on all of the information that's provided by their employees when they accept or waive their employer's offer of coverage. There is a minimum participation rate calculator available on HealthCare.gov that can help employers and their agents and brokers determine or project if their small business will meet the minimum participation rate. But once again, we are still in that 1-month window, which is an annual window where small employers don't need to actually meet that minimum participation rate. So also new for plan year 2016 is the option for employers to offer their employees and, if applicable, dependents only health coverage through the SHOP Marketplace, only dental coverage through the SHOP Marketplace, and both health and dental coverage through the SHOP Marketplace. So employers do have a lot of coverage offer options. And I will note that if an employee is offered both health and dental coverage, he or she may choose to enroll in either both the health and the dental coverage, only the health coverage, or only the dental coverage. And if the employer chooses to offer coverage for their employees' dependents, the dependents have the same enrollment options. However, the employee must first enroll in health or dental coverage before the dependents can enroll. And employees and dependents must enroll in the same health or dental plans. Excuse me. So next, we're going to talk about employee choice. I've mentioned in the presentation that employers have the option to offer their employees one plan or a choice of plans, and so I'm just going to go over in a little bit more detail how this actually works. So through employee choice, employees get a choice of health and dental plans, but their employers gets to, Okay. So through employee choice, employees get a choice of health and dental plans, but their employer gets to set basic limits by deciding which category of plans to offer and how much to actually contribute to premium costs. And offering employees a choice of plans can provide advantages for both employers and employees. Employee choice can mean less hassle for employers because they don't have to spend as much time trying to find one plan to fit all of the needs of all of their employees. And it also means that employees can select the plan that works best for their individual needs. And offering employees a choice of health plans, as many large employers do, can help a small business attract and retain valued employees. And when employees can choose their own plan, the insurers have to then compete for their business, which can lead to lower cost and better service. And with the SHOP marketplace, more choice comes with less paperwork. No matter how many different insurance companies or plans the employees select, the employer gets and pays just one monthly bill, and the SHOP takes care of dispersing those payments. So next, I'm going to talk about some of the tools that are available on HealthCare.gov for you to use before you even enroll in SHOP coverage. So before the employers even begin their SHOP marketplace application, you can visit HealthCare.gov to get a look at price estimates for all of the qualified health plans and all of the qualified dental plans that the SHOP marketplace offers in your area by using our online premium estimation tool. Users will just answer a few quick questions, such as whether they're looking for health benefits or dental benefits, and select the state where their primary business address is located. And the price estimates are based on the age ranges of employees and where the business is located. I'll note that the estimates reflect prices for people who do not use tobacco. Insurers are allowed to charge higher premiums for tobacco users. Agents, brokers, or navigators can also help employers use this tool and make plan comparisons. And lastly, I'll also note that neither the price estimates on HealthCare.gov nor the final quote will reflect any savings that an employer might be eligible to receive through the Small Business Healthcare Tax Credit. So next, I'm just going to provide a brief overview of the actual enrollment process for the employers. There are two ways for employers to enroll their group in the SHOP marketplace through HealthCare.gov. Employers may authorize a SHOP marketplace registered agent or broker to help them with their application and enrollment. And I'll note that an agent or broker can be added to an employer's application at any point during the enrollment process. So if you begin enrolling on your own and you realize that you need some further assistance, you can authorize the broker later in the process, or you can authorize them right at the beginning. So if an employer has already created a HealthCare.gov account, he or she can authorize a SHOP registered agent or broker by logging into his or her HealthCare.gov account, and you can select Get Assistance. And employers can search for an agent or broker by name, national producer number, or NPN, or location. And once authorized, agents and brokers can complete all of the application and enrollment functions on behalf of an employer client, except for making payments. Employers must make all of their SHOP marketplace payments. And once the coverage has been offered and the employees and if applicable, their dependents have made their coverage selection and the minimum participation rate has been met, the employer must submit the initial premium payment in order for the coverage to go into effect. So on this next slide, we just kind of provide a high-level overview of how employers can enroll without the assistance of an agent or broker, and I won't go into this in a lot of detail. We can come back to the slides for that brief step-by-step overview. So lastly, I'll just wrap up quickly. The SHOP Marketplace, as I've mentioned, offers many ways to get help. The toll-free SHOP call center offers assistance to employers, agents, and brokers, and now also to employees who are enrolling in employer-offered SHOP Marketplace coverage. Employers who create an online account in the SHOP Marketplace on HealthCare.gov can find a SHOP-registered local agent or broker online and can authorize that agent or broker to help them with their enrollment and manage their employer SHOP account online. If an employer has not created an account, they can use the Find Local Help feature on HealthCare.gov to locate a SHOP Marketplace registered agent or broker in their area. And sole proprietors, the self-employed, and other individuals, self-employed individuals with no employees, and those assisting them can call the Health Insurance Marketplace for individuals and families, and that number is also up on your screen. And the Health Insurance Marketplace the call center is open 24/7 except for certain holidays. So with that, I'll turn it back over to Meredith.
Great. Thanks so much, Laura. And just a final flag, because, again, we're coming up on this deadline so fast, for the December 15th deadline if you want to get coverage through the individual marketplace by January 1st. Open enrollment is continuing through January 31st, but we know lots of plans are expiring and coming to a close, so January 1st coverage, you would need to sign up by the 15th on Tuesday. And so now we're going to transition to our third and final main topic, employer shared responsibility. These are the provisions that say that if you're an employer with 50 or more employees and you don't offer coverage to your full-time folks, or you do offer coverage but it doesn't meet certain definitions of affordability or minimum value, then you may have to make a shared responsibility payment, also called an employer shared responsibility assessable payment. So we're going to talk about which employers are covered by these provisions and a little bit about how the payments work, and we just want to provide you with enough of an overview so that you can take this information to your tax advisors or other trusted advisors and figure out what it may mean for your business. So again, it's the threshold cutoff of employers that are covered by these rules are those with 50 or more employees, and that includes full-time equivalents. And I don't think I fleshed out that concept when we talked about the tax credit, but a full-time equivalent employee is basically a combination of employees who together collectively equal a full-time employee. And for the purposes of employer shared responsibility, the definition of full-time employee is somebody working 30 hours a week or more. So just to give you a sense of which employers are subject to these provisions, about 96% of firms in the U.S. are below 50 employees. And because the cutoff of coverage here is 50 or more, it's only about 4% of firms in the U.S. that are subject to employer shared responsibility provisions. So again, some of the key things to know if you're trying to figure out, do I meet that definition of 50 or more employees? As I mentioned, full-time equivalent means somebody working 30 hours or more per week. Full-time is 30 hours or more per week, so a full-time equivalent would be a combination of folks, as one example, 2 employees who are working 15 hours a week or more. And so you're taking the average of your employees over the course of a calendar year, and if you're averaging 50 or more employees, including these full-time equivalents, for the year, then you would be subject to shared responsibility in the following year. So you're essentially looking back a year to figure out if you're subject to employer shared responsibility. Also, the averaging over the course of a year means that you are taking into account fluctuations in workforce. So we often get the question, well, what if I'm kind of just at the threshold and I go up above 50 for a couple of months? That's not likely to mean that you're going to be covered, since it is the average over the course of a year. The other important thing to know when you're figuring out if you meet the threshold of 50 or more is that the IRS's controlled group rules apply, And these are, long-standing IRS provisions that say that employers with common owners or those who are otherwise related to one another add their employees together to figure out if they meet that threshold of 50. And so what that means practically is if you have, as just one example, there are many examples, but as one example that the IRS gives, if you're an individual who owns 80% or more of two firms, two businesses, they're separate legal entities, but because the same individual owns 80% or more of both entities, those firms, let's say A and B, have to add their employees together. And if collectively they have 50 or more employees, both Firm A and Firm B are going to be subject to the employer shared responsibility provisions. So again, that's just one example. If you're part of a control group, you've likely been filing that way for tax purposes, but of course if you have any questions, we would urge you to consult with your tax advisors. And there are an extensive set of resources available through the IRS's website, HealthCare.gov/ACA, on this very topic. So that's also an additional resource that folks can use. So now let's look at how these rules work if you do meet that threshold of 50 or more full-time, including full-time equivalent employees. And we've got in parentheses the 100 employees or more. That's because for 2015, there's some transition relief for those employers with 50 to 99 employees. For that group of employer, generally speaking, you're not subject to shared responsibility this year. Those rules will take effect for you in January of 2016. So that's a one-year transition provision for employers on the smaller end of those that are subject to shared responsibility to give them additional time to prepare for these provisions. So that's why you see the 100 employees in parentheses at the very top of the slide. So there are two scenarios in which an employer who has 50 or more employees may owe one of these shared responsibility payments. We've outlined the two scenarios on this slide, and we'll break it down a little bit more in the next few slides. So the two scenarios, first, an employer who doesn't offer coverage to at least 95% of its full-time employees and their dependents. That's one category of employer that may owe a payment. Or the coverage offered to the employer's full-time employees isn't affordable or doesn't provide minimum value coverage. We'll look at those definitions. Or a particular full-time employee wasn't offered coverage. And for either one of those two scenarios, at least one full-time employee goes to the marketplace to buy coverage, the marketplaces that we've been talking about today, and receives a premium tax credit. So another way of stating this is if one of your full-time folks goes to the marketplace and receives a premium tax credit, that could trigger a shared responsibility for you as the employer, because either you didn't offer coverage to a full-time employee, that would trigger one of those shared responsibility payments, or you did offer coverage, but as I said, it wasn't affordable or didn't provide minimum value. So I know it's a lot on one slide. We'll take a deeper look in the next few slides. So what does it mean to offer affordable minimum value coverage for the purposes of that second category? Minimum value coverage means that the plan that you're offering covers on average at least 60% of the overall costs of the plan, so that your employee is responsible for 40% or less. So that's minimum value coverage. And then affordability means that it's based on household income. So if the plan that you're offering to your employee, if their share of the lowest cost self-only coverage is more than 9.5% of his or her household income, that would be considered an unaffordable plan to that employee, and it may trigger a shared responsibility payment. Because employers may not know or have access to household income, the IRS has said that there are 3 alternative methods employers can use to demonstrate affordability. We've got one of those on this slide. It's called the Affordability Safe Harbor, and what that means is if the cost to the employee of the plan that you offer, a self-only plan, is no more than 9.5% of his or her wages on the W-2, that would be considered affordable. So you would have met the affordability test for the purposes of these provisions. So now let's look at the 2 potential payments that may be owed depending on the two categories that we've already outlined. So on the left-hand column, that's the employer who doesn't offer coverage to at least 95% of its full-time employees. It's a slightly reduced requirement of 70% for 2015. Again, a payment would be owed under that scenario if any of your full-time employees receives a premium tax credit toward purchasing coverage in the individual marketplace. That would trigger a payment. And the payment owed is $2,000 per year times the number of full-time employees in excess of 30. So in other words, you're taking that multiplication of 2,000 times your full-time folks, but you get to, offset, offset 30 employees from that calculation. And for 2015, you get to offset 80 employees in that calculation. The second category of payment, coverage is offered to your full-time folks, but it's not affordable based on the tests we just looked at, or it doesn't provide minimum value. And in that case, the payment owed is $3,000 annually multiplied by only those full-time employees who receive a premium tax credit. So not all of your full-time folks, but only those that actually receive the premium tax credit. And then a few other things to know about shared responsibility. We've touched on some of these today, but whether an employer owes a payment depends on whether it offers coverage and whether that coverage meets the test of affordability and minimum value, rather than whether an employee accepts the offer of coverage. And that's because if you're making an offer to a full-time individual and it meets the tests that we've talked about, they would then not be eligible to get a premium tax credit, right? So the premium tax credit is what triggers these payments, and if you make an offer of coverage that meets these minimum value standards and affordability, an individual would not be eligible to get a premium tax credit, and therefore a payment wouldn't be triggered. So that brings us to the third point. It's only the receipt of the premium tax credit through the marketplaces set up under the ACA that trigger the shared responsibility payment. In other words, if an employee gets coverage through any other source outside of the marketplace, through a spouse, another, Medicare, Medicaid, that would not trigger a shared responsibility payment, even if the coverage that you offered to that individual didn't meet the minimum value standard or wasn't affordable, or you didn't offer coverage to that individual. If he or she gets coverage through another source as a result, that's not going to trigger the shared responsibility payment. And then no employer payment is owed for part-time folks. That's the second bullet, even if they get a premium tax credit. And then finally, in order not to be subject to an employer payment, employers that offer coverage to their full-time employees must also offer coverage to the dependents of those employees who are kids under the age of 26. So there's no requirement of spousal coverage. We've talked about the transition relief as far as if you have 50 to 99 employees, generally speaking, you're not subject to shared responsibility in 2015. You do have to certify that you didn't reduce the number of employees or their hours in order to get that transition relief, and that you maintained any previously offered health coverage. And then the employer shared responsibility payments that we've talked about today are not tax deductible. So quickly, because it does relate to the employer shared responsibility provisions, we wanted to talk about the new reporting requirements. There are two types of reports that are new under the ACA. One applies if you have 50 or more employees. At the top of this slide, we say applicable large employer. That's just the statutory term for an employer who averages 50 or more employees. So if you're subject to shared responsibility, you're also subject to these new reporting requirements. You're considered an applicable large employer. There's no transition relief for these reporting requirements, so unlike the transition relief I mentioned for the shared responsibility provisions, if you have 50 to 99 employees, you have that additional year. That transition relief doesn't apply here. So these rules took effect in 2015 and apply across the board if you have 50 or more employees. And the first reports are due in early 2016, and you are reporting information like the number of your full-time folks, and the coverage offered to those individuals, the lowest employee cost, the months the employee was covered, etc. So all of that information is used to reconcile, whether an individual owes a payment because he or she may not have had coverage over the course of the year as required under the ACA. It also tells the IRS whether you as the employer may owe a shared responsibility payment. So the information is provided both to your employees and to the IRS. And those are the transmittal forms referenced on this page, the 1094s and 1095s. And again, all of this information, because it relates to tax provisions, can be found at irs.gov/ACA. And then the second type of new reports are called, or they apply to those providers of minimum essential coverage, including any self-insured employers. So if you're self-funded, you also have new reporting requirements, same time frame, and these reports, transmittal forms, the 1094B and the 1095B. And then finally, won't cover this slide in a lot of detail because we want to get to your questions, but all of these additional provisions that we didn't cover today that may impact you as a business owner, including waiting periods under ACA, additional incentives under the workplace wellness provisions, all of that can be found at the SBA website, sba.gov/healthcare, with links out to the relevant resources from IRS and HHS. And here is just, again, a reference link to the provisions we've talked about today. Of course, the marketplaces at HealthCare.gov, our website, the IRS's website that I mentioned, and then additionally business.usa.gov, which provides resources and tools across a variety of topics that are pertinent for small and larger businesses, including healthcare. And with that, Laura and I will quickly take a look at the questions that have come in and try to answer as many as we can in the last 12 minutes.
Thanks so much, Meredith and Laura, for presenting, and I want to thank our participants for joining the webinar today. As we're waiting for Meredith and Laura to look over the questions, I just want to remind you all that a copy of today's slides will be available after today's presentation, and this webinar is being recorded, so the recording and slides will be available in the very near future. We'll be moving into the question portion, so I'll leave it to Laura and Meredith.
Great, thanks, Mary. I'll kick it off with some questions. So a couple of you have been asking about how to use an agent or broker and if there's a cost associated with using one. So generally there is no additional cost to using a health insurance agent or broker through the SHOP marketplace. They're there to assist you for no additional fee. Their agents and brokers are generally paid through the insurance companies for selling their plans. So it's a cost that's built into your premium. So it won't, if you use a broker, it won't change your premium cost. If you don't use one, it won't change your cost. So there is no additional fee associated with using them. So I just wanted to clarify that. And again, if you would like to work with an agent or broker, you can either go to HealthCare.gov and use Find Local Help to find one in your area, or if you've already created a SHOP Marketplace account on HealthCare.gov, you're able to find one within the SHOP Marketplace actual application by going to the Get Assistance tab. I did see another question about the employee choice and how the employer can choose the options. So currently in the SHOP marketplace, if an employer decides that they would like to offer their employees a choice of health or dental plans, what the employer can do is they select one meta level. So within on the marketplaces, the plans are grouped out into gold, silver, bronze, and platinum plans. So the employer will select one of those levels. So for example, the employer would choose the silver level option, and then the employees can choose any of the plans that's offered within that one meta level. So the employer gets to decide what level to offer, and then the employee can choose any plan within that level. If an employer doesn't want to offer their employees a choice of health or dental plans, they can just select one health or dental plan available available through the shop and just offer that to their employees and, if applicable, their dependents. Just scrolling through some of these. There is a question here that if an employee accepts the coverage through the offer of shop marketplace coverage through an employer, can they still qualify for a premium tax credit too? So the answer to that is no. If individuals who are enrolling as individuals through the health insurance marketplace for individuals and families, that's the only place where tax credits are available. If an employee is offered affordable coverage, and Meredith can speak to the specifics of the affordability test a little bit more, then they can't go onto the individual market and get a premium tax credit. They would have to either pay full price for it, or they can accept their employer's offer of shop marketplace coverage. But the general note here is that if an employee is offered affordable coverage from their employer, whether it's through the shop or not, the employee can generally not receive a premium tax credit through the individual marketplace. Meredith, did you see any you wanted to take a stab at while I scroll through the rest of these?
Sure. So I think I covered some of these when I talked about the tax credit, but it's probably worth reiterating. So first, for the tax credit, what about nonprofit organizations? So as I mentioned, nonprofits are eligible for the tax credit. It's just a slightly lower amount of a credit, up to 35% if you're tax exempt, and of course it works in the form of a refund. And then related to this, how do nonprofits apply for the tax credit at the end of the year? So it's sort of a two-step process. Regardless if you're for-profit or nonprofit, you have to fill out the form 8941, credit for small employer health insurance premiums. Again, 8941, that calculates the credit. And then if you're tax exempt, you would include the amount on line 44F, as in Frank, of the form 990T, as in Tom. So you're using the one form to claim the credit, and whatever that amount looks like, you're entering that amount on the form 990T, which is exempt organization business income tax return. So to get the credit, you have to file that 990T, even if you wouldn't ordinarily be filing that as part of your tax filings. And if you're a small business, a for-profit, you would include the amount of the credit as part of the general business credit on your income tax return. In terms of the reimbursement or the credit, rather, getting a question about, I mentioned 50% of employees self-only coverage. What if the employer is covering spouses and children? So great question. So the requirement under the tax credit, it's the third eligibility requirement, that the employer pay a uniform payment of at least 50% of self-only coverage. That requirement doesn't apply to dependent coverage. So you can pay less than 50% of dependent coverage premiums and still include those premiums in the credit calculation. So thank you for that clarifying question. And then I think I hopefully also mentioned that you can both take the credit and take a deduction for a partial deduction for the remainder of the premium contributions. So that's something unique to the tax credit. Also, what are the negatives to employees who opt out of group health insurance? So, the immediate thing that comes to mind, and I'm not sure if this is what you're getting at with this question, but I think as folks know by now, under the Affordable Care Act, if an individual doesn't have coverage for over the course of a year and doesn't otherwise qualify for an exemption from that coverage, then as an individual you may owe a payment or a fee for not having health insurance. And in 2016, that fee is $695 per adult, $347.50 per child under the age of 18, or 2.5% of your annual household income, whichever is higher. So that payment has gone up significantly from last year. So again, if folks choose not to have health insurance in 2016, they're at risk of paying that fee. So that's one I guess, downside to opting out of group health insurance if you're not otherwise planning on getting covered or have additional coverage, and you elect not to get covered through your employer. So hopefully that answered your question. Laura, any others that have come through? I just haven't looked at the recent batch as I was going through these particular questions.
Yeah, so there's a question here about how does a group with 1 employee in New York and 3 employees in Colorado enroll? Both New York and Colorado are state-based marketplaces, so I would encourage you to check with the marketplace in your state. But generally, as I mentioned earlier, for those states who are utilizing the SHOP marketplace on HealthCare.gov, there are 2 options for those employers who have employees in multiple states. The employer could either set up one SHOP marketplace account in the state where the primary business address is located and offer coverage options that has a multi-state network, and I suspect this is what the answer to this particular question is as well, the employer can set up a SHOP marketplace account in each of the states where they have the primary work site and where they have employees in those states and offer coverage through the respective state marketplaces. So I hope that clarifies that. But in terms of the state-based SHOP marketplaces, those who are not utilizing HealthCare.gov, I would encourage you to check in with your state-specific SHOP marketplaces. And there is also a question about when you sign up for coverage, do you have to pay right away? So the answer to that is yes. Once an employer offers coverage or SHOP marketplace coverage to their employees, and they've either enrolled during the 1-month window where there's no minimum participation rate, or they've met the minimum participation rate requirement for their state, the employer will then have to submit their initial premium payment in order for the coverage to actually go into effect. So once the minimum participation rate is met, the employer must pay their initial premium in order for the coverage to actually be effectuated.
And Laura, if I can jump in, just a couple of questions that have come in clarifying employer shared responsibilities. So again, if you are an employer with less than 50 employees, you're not required to provide insurance to your employees. So again, that's assuming you're not part of a control group, as we talked about. But if you're standalone, not part of a control group, and you are a for-profit or non-profit or religious organization with fewer than 50 employees, you are not required to offer health insurance to your employees under the Affordable Care Act. So hopefully, I think we got a couple of questions coming in on that, so just wanted to jump in and clarify that. And I think, just procedurally, as we mentioned today, we will be emailing a copy of the presentation out to folks, and then we've also recorded it, so we'll archive it at sba.gov/healthcare. Again, sba.gov/healthcare. So we have about a minute left, just seeing if there are any other questions we can that have come in recently. Laura, anything on your end?
I think we covered all of the big ones. So I think I'm good on the SHOP end.
Okay. Mary, we'll turn it back over to you to close us out.
Great. Thank you so much. Thank you all for joining us today. Thank you, Meredith and Laura. And this concludes today's presentation. Please remember to fill out our post-webinar survey as you're closing out, and keep an eye out for those slides that will be coming to you via email. Thank you all so much today. Happy holidays.